Hi, my name is Felicia Graniero. I'm a mother of a 19-month-old baby girl. When we started off to start having a family, we were very eager. It was like our joy, like our dream come true that we finally decided to have a child. So as time went by, Amanda was growing inside my womb, which felt so nice and warm. And my husband would always say, "How does it feel? Just place your hand on my tummy." And as soon as he placed his hand, it's like his daughter felt the warm hand of her father, and she'd be kicking around. So as months went by, it came to the point that I started getting contractions.
Tell me about the day you went to the hospital and describe to me what happened.
Everything was going fine, and I was pushing and pushing, and I pushed for about 2.5 hours till I had Amanda. And that's when our dreams shattered.
What happened?
When Amanda was born, she had no cry, no reflex, not even kicking her legs, just there like a vegetable body just coming out. I was just like looking at her like, "What's wrong with my baby? Would someone please tell me what is going on?"
But up until that time, everything had been normal.
Yes, it had.
You'd had a normal pregnancy?
All the blood tests resulted all normal. Amanda's heartbeat resulted normal. Everything was excellent.
What did the doctors tell you?
They didn't tell me anything. They took her right away to the intensive care unit upstairs. And things started getting worse. 90 minutes after her birth, my daughter started seizuring. And that was like a disaster for us, because we knew that when someone starts seizuring, there's something wrong with the brain.
She slept for about a week, and they didn't know what was going on, if she would come out of it or what would be the outcome.
I'd be talking to her, singing to her, trying to see if she would respond to me as being her mom, of singing her those little songs when I used to sing to her when I was pregnant. And I remember singing to her. She actually smiled at me. There was a little smile, and that's the message that I got, that yes, she will make it. So it's like a miracle happened. The next day she did wake up and she was moving, just that unfortunately her reflexes weren't all there because she had brain damage. But that wasn't important for me, just the fact of her awakening from her nightmare. It was like a dream come true.
So it took a few weeks before you actually got the verdict. Take me back to that day. What did the doctors tell you?
I remember we sat in a meeting with the neurologist and the whole team, and they told us, "We don't know if your daughter will be able to walk, speak, move." And her scan showed that Amanda had devastating segment of the brain missing, no cortex left around her brain. They gave us no hope at all.
When the doctor told us that she has cerebral palsy, that was really hard on us, because when they told us that, and now what happens? What happens with her? What do we do? What can she do? What can we do with her? And it's like everything is totally what you hoped having a child would be. It's just thrown away in front of you.
It was the end of the world. It's like the world just collapsed on us.
We just trusted the doctors to tell us what to do. But we noticed as months went on, we weren't seeing much.
My husband and I started to use internet of friends to try to get information, and
Well, I present myself. I am Dr. Amsalem Maurice, GP for 4 years. I've seen the patient Gallo Amanda since she's born. She was coming in my office and showing cerebral palsy, secondary to a problem of birth. She has lacking oxygen, and she was complete paralyzed, like cannot moving her neck, her legs, no sound coming. I follow her for 10 years. What I find out after she received a treatment with stem cells that her behavior changed completely, and I have in front of me the CT scan with perfusion done in the 23rd of January 2002, and the conclusion and impression is cerebral palsy with gradual improvement after stem cells. There was increase of about 20% to 30% increase of the cortex, which is absolutely fabulous. I can see that in this time this young lady changed a lot, and I can see her that she is able to smile, able to hold her head and move her head right to left. She follows you with her eyes moving arms and feet correctly. She can say a few words and sound. She's able to stand, and now she's able to walk with a walker. She understands when you're talking to her, and she responds with a smile. She tried to crawl too. I'm absolutely amazed that the treatment improved so much this lady, and I think she's going to get better and better following these treatments.